to the clinic. I'm Dr. Casual. See, we have you in for a cranial nerve exam today, is that right? Great. And your name? Good. And what's your date of birth for me? Very good. So, today we are going to be doing an assessment of your cranial nerves, ranging from your sense of sight, touch, taste, and smell. And we're doing this to assess to see if there's any neurological issues that you may be suffering from. Alright? So, please go ahead and take a seat. We'll give you a quick checkup real quick, and then we'll get into the exam. Sound good? Great. Alright. So, first things first, we're just going to take a quick listen to that heart of yours. I'm just going to come up a little close. Alright. Warm it up for you. Alright, now go ahead, take a deep breath in and out. Take a deep breath in again and out. Good. Good. Okay. Now over here, take a deep breath in and out. And take a deep breath in and out. Good. Now just breathe normally. You can listen for your heartbeat. Okay. Very good. Very good. Just relax. It's okay. Nothing to be nervous about with this exam. And over here. Alright, very good. Very good. Lungs and heart sound perfectly healthy. That's wonderful. Alright. Very good. Now I do want to take your blood pressure real quick, just to double check. Make sure everything looks good. So, just going to be putting this blood pressure cuff on you. Alrighty. So, I'm going to stick this around your arm. Alright, very good. Very good. Just hold still for me. Alrighty. And let's get that going. Alrighty, and good. Blood pressure is perfectly normal. Absolutely great. Alright, now let's get started on the exam, shall we? First things first, I'm going to put on a pair of gloves, and then we'll get started with your exam. So, lately, have you been noticing any problems with your vision, sense of taste, smell? Have things been seeming duller to you? No? Alright. That's good. If there's nothing obvious, then there's most likely going to be no problem. And we even got these new allergen-free gloves in the clinic for people with that pesky latex allergy. Alrighty, so first things first, let me just take a look at you. I'm going to be just looking around your head, looking around your hair, making sure there's no lesions, bumps, or anything that's out of the ordinary. Do see you have a little bit of a scar here on your scalp. Accident from when you were a kid. I think we all have some battle scars from when we were a kid. Alright. Let's take a look at that face of yours. Just look straight at me. Just going to press around the temples. Feel that pressure? Is that painful? No? Alright, good. And down here behind your ears. Again, I'm going to press gently. Does that hurt? Any discomfort? No. Very good. Very good, very good. Okay. Alright. So that looks good. Alright. So first things first. We're going to test your olfactory nerve. So your sense of smell. I have 3 different scents that I'm going to be holding up for you to smell, and I want you to identify them for me, okay? Alright. So go ahead and close your eyes. Just going to open up the first vial here. Now, go ahead and take a sniff for me. There you go. Alright, what do you smell? Coffee. Very good. Alright, now under number 2. Alright, go ahead and smell that. And what do you smell there? Citrus. Very good. And one more. Go ahead and take a whiff of this. This one might be a little more tricky. Lavender. Very good. Very good. Well, your sense of smell seems to be intact. I'm just going to come up here real quick. I'm going to just gently press along your sinuses right next to your nose. Any discomfort there? No. Now if I palpate on the sides of your nose, any discomfort? No. Very good. I would like to take a quick look up your nose. Just very quick to make sure there's no swelling or anything that would be concerning. So just look straight at me, tilt your head a little bit. Okay, take a little look, Okay. So it looks good. And let's take a look at the other side here. Okay, very good. I know, a little bit uncomfortable, but your nose looks perfectly healthy. I'll change this tip up for later. Alright, olfactory nerve. Very good. Alright. Now we're going to move on to your optic nerve, alright? So we're going to be taking a look at your sense of sight. Now this takes a little bit of time. Alrighty. Let me know if at any point your eyes become fatigued or you're feeling uncomfortable, and we can take a little break. Alright? Good. So, first things first, I'm just going to take a visual inspection of your eyes. Look straight at me. Straight at me. Take a visual inspection just to see if there's any issues obvious. Going to gently just press right under your eyes. Any discomfort? Any discomfort? No? Good. And if I press right above your eyes, any discomfort? No. Very good. Very good. Alright, so right now I'm going to test your pupillary response. So I'm going to be taking this light here. As you can see, not very bright. And I'm going to be blocking off one of your eyes and swinging the light in and out of your field of vision to check your pupillary dilation. So please stay still. And just going to check how the pupil dilates. Very good. Very good. Just keep looking straight at me. Straight at me. Very good. And the other side here. Okay. And in, out, and in, and out, in again, and out, and in again, and out. Very good. Pupillary response. Very good. All right. For this next part, I would like you to keep your head straight, look straight at my nose, and I would like you to follow the light with your eyes without moving your head. Alrighty? Now go ahead and follow, follow, follow. Follow the light, follow the light, follow the light. Very good. Very good. Keep following. Keep following. Very good. Very good. Great. Visual acuity looks good. Alright, now look straight at me, and I'm just going to swing the light. Just follow with your eyes real quick. Real quick. Very good. Again, with your head straight, I'm going to be bringing my finger very close and then very far away, looking to see how your eyes focus. So, look straight at me, and now focus on my finger. Very good. Very good. Over here, again, focus on my finger, focus on my finger. Good. Very good. Good. Very good. Okay. Now, this next part may be a little uncomfortable. I'm going to be testing how your eye reacts to outside stimuli. So what I'm going to be doing is taking a cotton swab and gently brushing right here at the corner of your eye on each side, just to test your blink response, okay? All right. So, just going to take a little cotton ball here. And what we're going to do is we're just going to pull out the tiniest little wisp. And I'm just going to gently bring it up to your eye and brush, brush, brush. Very good on that side. And then over here, brush, brush, brush. Very good. And that's that. Not a problem. Blink response looks wonderful. Very good. Alright. Now I'd like to test your peripheral vision. So what I'm going to do is I'm going to be holding my fingers up like this, and I'm going to be bringing them in and out of your vision. And I'd like you to tell me when you can see them, and then when they're gone. Alrighty. So, look straight at me, straight at my nose, and good. Good. Again. Good. Great. Let's go this direction. Good. Good. Again. Good. Alright, peripheral vision looks good. Now I would like to do a color assessment on you. What I have here are some Ishihara plates. There is a number inside of the circle, and I would like you to read that back to me. 26. Very good. 8. Very good. 12. 5. color vision is perfect. Color vision 100%. Okay, now we're going to take a little closer look inside of your eyes, alright? So, first things first, going to do a little bit of a up-close visual inspection. Alright, put that on 20. Now go ahead, look straight at me. I'm just going to come in here and look in your eye. Make sure that everything looks good. Okay. Alright. Everything looks good over here. Let's take a look at the other side, shall we? Alright, very good. Okay, very good. Now, just to be thorough, I'm going to be taking a even closer look with these goggles. So again, just stay still for me. I just need to make sure that ocular nerve is looking good. Very good. And let's take a look at the other side here. Okay. Alright. Well, your eyes look very, very healthy. We do have one more, or two more parts of the eye exam for you. Alright. Now we're going to be doing a classic eye chart exam. So, what I'd like you to do is start here, with both eyes open, and just read as I point to the letters. Very good. 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 And can you get this line right here? Very good. Very good. Now, for the next eye chart, I'm going to have you look over here at the chart behind me, and I'm going to give you a set of instructions to follow along. This will include covering one eye or the other and following along with where I point. Alright? Great. So, just look over here for me. Okay. Now, to begin this part of the eye exam, I would like you to cover your right eye, and please read the letter I point to, starting here. Good. Good. Now, please read this line. Good. 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 Very good. Good. And this line. Good. Very good. Good. Now go ahead and cover your left eye for me. And can you read this? Good. Very good. Good. Very good. Now down here. Very good. Good. Yes. Good. Very good. Now, with both eyes, can you please read this line? Good. good. Mm-hmm. Good. Good. Very good. And one more line all the way down here at the bottom. Good. Good. Very good. Good. Mm-hmm. Little tricky. There you go. Very good. And last one. Good. Okay. Your eyes look amazing. Let's get back to the rest of the exam. Well, my friend, your eyes seem perfectly intact and perfectly healthy. Don't see anything wrong with them. So for the next part of the exam, we are going to be testing your trigeminal nerve, which is the sensation of touch around your face. So first things first, what I'm going to do is I'm going to come up a little close, and I'm just going to palpate around your jaw here. Just feeling to make sure everything is where it's supposed to be, and gently palpating those lymph nodes. Yep. Make sure they're not swollen. Alright, with my hands under your jaw, go ahead and clench real tight for me, like this. Just bite down. Okay. Now do it one more time. Good. And I'm going to place my fingers gently along the sides of your trachea. Now please go ahead and swallow for me. Very good. One more time. Big swallow. Good. Very good. Now I would like to do a jaw jerk reflex. So what I'm going to do is I'm going to take my thumb, I'm going to place it right below your lip, and I'm going to gently just tap it with the hammer, okay? Just to check the reflex real quick. This will not hurt. So go ahead and great. And one more time, and fantastic. See? No problems. Jaw jerk looks very good. Very good. Now I'm going to be doing a sensation test. So I'm going to be using one of these cotton swabs. Now, as you can see, the swab has a pointed end and it has a dull side. What I would like you to do is close your eyes for me. Just go ahead and close them. Close them. Close them. And what I'm going to do is I'm going to touch you on different parts of your face, and I want you to identify whether it's the pointed side or the dull side. Alright? You can say dull or sharp if you'd like. Okay. Alright, so close those eyes. Close them, close them. And here we go. And touch. Dull, very good. And touch. Dull again. Touch. Sharp. Touch. Sharp. Touch. Dull. Touch. Dull again. Sharp. Touch. Sharp, very good. Touch. Sharp again. And now I'm going to move over here and touch. Dull. And touch. Sharp. And touch. Dull. Very good. You can open your eyes now. Okay. So that looks good. And I'm going to do one more assessment. I would like you to open your mouth for me. I'm just going to take a quick look inside. I know. Never fun. But we are not looking to elicit a gag reflex right now from you, so I am just going to be using this tongue depressor just to move your tongue to the side just so I can see inside your mouth, okay? Alright, so go ahead, open wide, give me a big ah. Alright, let's take a look. Let's take a look. Take a look. Your teeth look very good. You're brushing twice a day, correct? Good. How about flossing? Alright. So you still have your tonsils, and seeing any red splotching or white splotching on the back of the throat. Everything looks good. Uvula looks healthy. Okay. Now one more last thing. Please go ahead. A big ah. I'm going to be grasping your tongue with this tissue. Just moving it side to side. Make sure I can look at the underside. And there's no bumps or lesions or anything concerned. So open up. Just going to grab your tongue there. Just move it. Okay. And look at this side here. Okay. Everything looks good. You can go ahead and close your mouth and just toss this in the trash can. Very good. Alright. Now, continue on with your mouth. Have you noticed any changes in your sense of taste lately? No. Do you have a cold or have had a cold in the past 2 weeks? Because that can sometimes modify your sense of taste. No. Okay. So we're going to do a little bit of a taste test. So I'm going to ask you to close your eyes again. And I'm going to be dropping a few drops of a different taste tincture on your tongue. And I'd like you to identify for me. Alright. So, go ahead. Close your eyes. No cheating. So, first things, first drop. And what do you taste? Coffee. Very good. Let me get the other one. Okay, and open up and drop. What do you taste? Chocolate. Very good. Alright. And one more. Drop. And can you tell me what you taste there? Lemon, very good. Oh, it looks like your sense of taste is intact. Now, one more thing with assessing your facial nerves. I'd like you to make a couple funny faces for me. So why don't you go ahead and give me a big smile. Very good. Give me a big frown. Very good. Go ahead and puff your cheeks out like this. Good. Open up your mouth real big. Good. Clench your jaw real tight. Very good. Great. Facial nerve intact. No issues whatsoever. And we're going to be moving on to your vestibulocochlear nerve, which is part of your hearing. So for this, we're going to be performing a few different tests. First things first, got my otoscope, and I'm going to be taking a look inside your ears just to make sure that there's no lumps or bumps again. Make sure there's no unnecessary wax buildups. So I'm just going to take a look inside. Check out the ear canal. Looks free of wax and debris. Tympanic membrane is intact and is not inflamed. Very good. Very good. And now over here, we're going to take a look at the side. Again, looking at the ear canal. Small amount of wax built up in here, nothing major. Tympanic membrane is intact and not swollen or inflamed. Good. Very good. Alright. Now what I'd like to do is for you to close your eyes again. I'm going to be making a sound in each of your ear, and I'd like you to just notify me with your hand up like this, or say yes, and when you can hear the sound and in which ear it's in, okay? Alright, so close your eyes for me. Alright, and very good. Very good. 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 Fantastic. Alrighty. Now I'm going to be performing a little test with my tuning fork here. I'm going to be doing this in two parts. In the first part, I'm going to be bringing the tuning fork, holding it up to your ear, and I would like you to tell me when you can no longer hear it. And for the second portion, I'm going to be bringing the tuning fork and then placing it behind your ear, on your forehead, and behind the other ear. And I'd like you to tell me when you can no longer hear it, okay? Good. So, close your eyes again. Good. Very good. Good. Fantastic. Now I'm going to place it behind your ear here. Good. And on your forehead here. Good. And behind the other ear. That one was very light, but you did spectacularly. Okay, my friend. Well, how are you feeling? Are you feeling well? Good. And are you uncomfortable at all? Does anything hurt? No. Alright. Good. Well, I am happy to say that I think you are perfectly fine. This is just a routine checkup for you. I don't think there's any issues that need to be addressed any further. If you do notice anything, though, please feel free to call and make another appointment. Be happy to see you. And as always, I hope you have a wonderful day. And I'll see you next time. Bye-bye.